Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Our focus tonight, emerging treatments for Alzheimer's disease. Millions of people have the condition. Tens of millions may be in the process of developing it. Tonight, in this Primetime Living segment, produced in partnership with the Maryland Department of Aging, we are joined by Dr. Paul Fishman, professor of neurology at the University of Maryland School of Medicine. Doctor, thank you for being with us.
Thanks for inviting me.
We think about Alzheimer's disease and we think about dementia. Are they the same thing?
They're close. Dementia is a general term that means the loss of thinking or intellectual function severe enough to interfere with day-to-day life. Alzheimer's disease is a progressive neurological disease that's the leading cause of dementia. So the usual estimates is it accounts for about 2/3 of the patients who develop dementia.
America's getting older, people living longer. Does that have anything to do with the increasing numbers of people with this condition?
That has a huge amount to it. Alzheimer's disease is not just related to age, it's related dramatically to age. So again, it's relatively uncommon in the 50s or 60s, becomes significantly more common, 5 or 10% in the population in the 70s, and again, it almost doubles per decade as you go from the 60s, 70s, and 80s. So again, it is one of the leading reasons why the number of cases of dementia have dramatically expanded over the last 10 years.
Unfortunately, I think almost everybody knows what it looks like when somebody is in the latter stages of Alzheimer's. But what are the early stages look like? What are the early signs and symptoms?
Well, in the beginning, it is difficult to sort out what are normal aging changes of forgetfulness, and particularly normal aging relates to speed-related tasks. You bump into somebody you haven't seen in a long time, you don't remember their name, and after they walk away, a minute or so later, you remember their name. These are common age-related things, so you start to see in the 60s, 70s, and throughout that. In Alzheimer's disease, it starts commonly with poor, what we call short-term memory, not being able to remember things over a few minutes. But then it starts to evolve into things that really interfere with day-to-day life. It interferes with judgment. It interferes with the ability to do complicated things like calculations, managing a checkbook, a person's personal finances. Using electronics may become more difficult. And that's a reason to start to address that, usually with your regular doctor. There are plenty of brief paper and pencil testing that can be done in any physician's office to really start to see, is a person at risk?
Is there a definitive test at this point?
Not really. There are very sensitive radioisotope tests that can look at brain function, and they can even look at the accumulation of some of the abnormal proteins in Alzheimer's disease. They're so sensitive that they actually detect individuals who have no problems whatsoever, who may be at risk of developing Alzheimer's disease because they have a genetic predisposition with multiple family members. But they're not used in basic day-to-day diagnoses.
I've read that there are people with some of the mechanical signs of Alzheimer's who don't exhibit the disease. Is that the case? Or they're early stage, you would say?
Well, we even think about what we even think of a preclinical stage. We know that the biochemical changes in Alzheimer's disease and changes in brain structure are occurring for days, for decades perhaps, at least years before anybody has any symptoms. And it's kind of a double-edged sword. We think that some of the treatment failures and there have been sadly many treatment failures trying to get a drug to slow Alzheimer's disease down. And many people believe that the failure of many of those treatments is that they've been applied too late. Now with some of these biomarkers, either blood tests, spinal fluid tests, or imaging studies, we are identifying patients who have biochemical changes in their brain that suggest that they're going to develop Alzheimer's disease. And the question is, can we apply a therapy to keep them from developing Alzheimer's disease?
Let me remind our viewers, if you have a question for the doctor about Alzheimer's and dementia, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPTNews. I'm curious what drugs, if any, you prescribe for this. What do you prescribe most often?
Well, during the time that people have symptoms, there are a handful of FDA-approved drugs. They're virtually all in generic. They've been around, and sadly, there hasn't been a new one other than combinations of old ones in several years. The one that's most widely used is called donepezil. Another one is called memantine. And these are modestly effective. And in some patients, you get some improvement in memory. In most patients, you at least get some stabilization. Patients with untreated Alzheimer's disease, sadly, lose intellectual function, through the months and years until really they're totally disabled.
Just watching TV this afternoon, saw an ad for some sort of supplement that was supposed to prevent Alzheimer's.
Well, there are many supplements that are proposed, and for most of them, there's almost minimal science behind them that says that they work. I think when patients bring them in, I stop counting at 50, the number of different ones. And that's the way supplements are regulated compared to drugs. All supplements and the ads for supplements carry a tiny little box that says on them, this is not regulated by the FDA. We make no claim to diagnose, treat, or cure any disease. And that's true, that most of them don't. Some of them have some science. Probably the natural product that has the most science behind it is probably one of the oldest, and that's ginkgo biloba. So at least there's some science that says that that can improve memory. Not so much treat Alzheimer's, but at least improve memory and attention.
So what would you advise people to do, people who are worried about this? And frankly, I think everybody to some degree is worried about this.
Well, really, there's a common sense approach. Pure Alzheimer's disease, particularly in older people, is rare. Sadly, when it comes to dementia, all bad things that we do to our brains are additive. And when we accumulate enough of those bad things, we really start to develop interference with intellectual function. We have a marvelously adapted brain, and we can do many bad things to it, and it keeps on ticking. And what it means is that many of the things that are heart healthy are probably also brain healthy, because for many of the people, there's a clear association between Alzheimer's disease and the second leading cause of dementia, which is called vascular dementia. And it's well known that the two of them are additive in a bad way. These are, things like diabetes is so tied to Alzheimer's disease that a lot of investigators think that there's a direct relationship between glucose metabolism and resistance to insulin. And it's part of the disease, and it's not just the vascular factor. But again, when it comes to the things that we would do for a healthy heart, there's a great deal of evidence that they're probably good for your brain, which means if you have high blood pressure, treat it. Obesity is a risk factor for diabetes and heart disease. So again, lower body mass, exercise.
Is there evidence, though,
Yes.
that obese people get Alzheimer's more frequently?
Well, they get dementia more frequently. And as I mentioned, a lot of times when someone has dementia, how much of that has Alzheimer's pathology and how much of that is vascular pathology is hard to tell. But we know on a population basis, there's less dementia. But the other part is, it really is over a lifetime. The people who have been tracked in studies that have gone on that are really studies that look at lifestyle over decades clearly have less dementing illness, including Alzheimer's disease.
Let's go out to the phones. Howard County, this is Tim. Tim, thanks for calling. Go ahead.
Yes, I've heard it proposed that too much copper in the diet could be a cause of Alzheimer's. And if so, does zinc really alleviate that as a problem?
Tim, thank you very much for the phone call. And I was going to ask in a similar vein, I had seen, this is a long time ago, that there was too much aluminum in some people's brains.
Yeah, the role of heavy metals has been kind of thought about for years, but there's no clear evidence. If you think about it, sadly, one of the greatest contributors to heavy metals are antacids. But again, aluminum is in many, almost every preparation of antacids, and there's no association with them. This was popular thought really in the 1980s because these abnormal proteins in brain bind heavy metals. And so you're always going to find them. The question is, are they causative? And there's very little evidence that they're causative.
Let's get one more call, then we'll look at the pretty pictures from inside the brain. From Montgomery County, this is Lisa. Lisa, thank you for calling. Go ahead.
Yes, my question is, how does one get an opportunity to go get tested for these early indicators?
Thank you very much. How would you get tested? Can you be tested for early indicators? And what would you do with that information?
And that's probably the better question. What would you do with that information? The people who probably ought to get involved in that are people who have strong family histories of Alzheimer's disease, and particularly family histories where it's not just age-related. Anyone who has a family history of longevity with relatives that live into their 90s are probably going to have a family history of Alzheimer's disease. But if it's young onset, at the NIH and at most major medical centers, there are research studies, and tagged to those research studies are some of these biomarker tests. And that's usually what they're paired with because we don't know the value of them, but they very well may help accelerate developing treatments for Alzheimer's disease.
All right, let's put your scientist hat on for a minute. We'll take the doctor hat off, and we'll talk about what's happening inside the brain. We have a couple of images of brain cells that maybe help people understand on a molecular level what's going on. And these are neurons we're looking at?
Okay. Well, the blue are neurons. And so what Alzheimer's saw over 100 years ago was abnormal brain cells. So this is a microscopic, this is an illustration based on a microscopic slice of human brain from a patient with Alzheimer's disease. And what he saw was the internal skeleton of brain cells, which is normal, started to have abnormal accumulation, and that's the blue. All brain cells, which are, may have little filaments that are inches long, maybe a foot long, they have an internal skeleton that maintains their shape. So they're making that filamentous protein, and in Alzheimer's disease, it abnormally accumulates. It has a particular, in the 1980s and 90s, we discovered biochemically what it was. It's a protein called tau. And there's a second protein that's actually secreted and accumulated in Alzheimer's disease and forms those brown globs. And that is amyloid and an amyloid plaque. And again, in the 1980s, we learned what they're made of. They're made of abnormal form of a normal brain protein. And that one's neurotoxic. It actually can kill other brain cells. And these have been major targets for therapy. And
Doctor, is there a role for stem cells in treating this?
Well, stem cells, there are really three roles. The hardest role for stem cells is to replace brain cells. And since the changes in Alzheimer's are so widespread across the brain, that hasn't really been feasible. When we think about things like Parkinson's, we're looking for a place, sadly, the way we get a brain cell into the brain is to do it surgically and inject it with a needle. And so it's really too widespread to be practical in Alzheimer's disease.
Let's grab another phone call, if we can, from Baltimore County. This is Gary. Gary, thank you for calling. Go ahead.
Doctor, could you tell me when you're diagnosed with dementia, how long is the period
where dementia, I've been told, leads to Alzheimer's disease, but I haven't been told anything about what the time frame is.
All right, thank you, sir.
Well, when doctors use the word dementia, and sometimes they just mean that they're uncertain of the diagnosis, and they don't have enough information to say specifically what type of dementia. And sometimes it's just a lack of, it's really reluctance to use the term Alzheimer's disease, to just, they don't want to use the A word for it. So I would talk to your doctor about, is there a more specific diagnosis? And a lot of times, remember, the commonest other dementia is vascular dementia, and they can be mixed. And so ask your doctor their best estimate of what they think is the cause of the dementia, and that can give a better idea of what long-term prognosis is.
Talk to me about the human side of treating people who have this condition. So you're dealing with them, you're dealing with their family members who become caregivers. It's a particularly difficult diagnosis to hand somebody.
Well, I think people are always better when empowered with information. And sometimes, at the request of family, when somebody's really impaired and they have very poor short-term memory, I won't use the term with the actually affected individual because it'll be distressing, it'll be forgotten within half an hour, and it doesn't add to anything. Now, whoever is managing, they have to have that information. And I may be a little evasive to the patient and say, your memory's not really as good as we think it is. And even if there isn't a drug that can cure them, there are a lot of things that are beneficial. Depression and anxiety are incredibly common and treatable and improve quality of life. There are lots of programs we taught in forms of activity where patients do better, be it physical activity, intellectual activity, social activity. And what's been a great societal change over the last 10 years is the number of different types of these programs that people, if they enjoy in motivation, and stress reduction seems to have a role in prognosis.
Twitter question, are delusions sometimes a symptom of dementia? My 85-year-old friend is convinced that she lives somewhere else.
That is definitely yes. They can be, and they can be commonly seen in Alzheimer's disease. And they can be, well, by their definition, a delusion is a false idea that's fixed. You can give that person all the logical reasons, and you can't convince them. They are very difficult to treat. They are very difficult to treat even with typical psychiatric medications. Patients with dementia don't respond well to the same kinds of delusions that in a psychiatric disease like schizophrenia they might respond to. So a lot of times counseling is very useful in that situation.
Let's get one more phone call. Montgomery County, this is Elizabeth. Elizabeth, thank you for calling. Go ahead.
I was wondering if eating non-organic foods contributes to Alzheimer's.
Thank you very much.
Well, there's no direct evidence in that. Certainly, a healthy diet, I think in terms of, I think the Mediterranean diet, which has whole grains, lots of natural antioxidants, those are the things, whether or not that seem to be more important, whether or not they come from a organic or non-organic source.
Where do you think the science is going to be, the clinical practice is going to be in a decade? It sounds like maybe we're on the verge of a couple of things. The idea that you mentioned earlier, that we could see early signs, and perhaps some medications that didn't work late stage may help early stage. What's it going to look like in a decade?
Well, I think molecular medicine is going to make a real impact, because what's going on now is the ability to look at a whole array of genes, more than the handful of ones that cause the rare inherited causes of Alzheimer's disease. And that helps us unravel that puzzle. And every time we identify one of these genes, it's a new target for therapy. In some ways, I think we have too many targets for therapy, not enough resources, and not a good enough systematic way of saying, that's the best idea, that's second, that's third. how do we do that, not by committee?
Professor Paul Fishman, University of Maryland School of Medicine. Doctor, thanks so much for your time.
Thank you again for inviting me.
Thank you for joining us for Direct Connection. We're back Thursday at this time with Your Money and Business. Have a good night.
This program was made by MPT to serve all of our diverse communities.